Hashimoto's. So let's get stuck in today and talk about this exciting topic. And in aid of the topic that we're discussing today, because we're talking about Hashimoto's thyroiditis or Hashimoto's disease, I've actually worn a little thyroid badge today. I love this badge. I think it's super quirky and cute. So I'll just be wearing that just in the theme of what we'll be discussing today. So let's talk about Hashimoto's, so otherwise known as Hashimoto's thyroiditis or Hashimoto's disease. Now, let's talk about what it actually is, what the typical symptoms are, and why it actually happens, and of course, treatment as well that I'd recommend in terms of Hashimoto's. So I'm so thrilled that you can join me this evening. For those of you that don't know me, my name is Michelle Cooke. I'm a period and hormone naturopath, I'm a natural fertility educator, and I'm a nerve practitioner, so naturopathic emotional release practitioner. And I help women struggling with their menstrual cycles have easy, pain-free periods, emotional well-being, and balanced hormones. So I'm the founder and director of Reproductive Wellness, a clinic based in Melbourne, and I see patients both online and face-to-face. So if you have any questions or comments as we go through the live this evening, just be sure to pop them in the comments down below in the box. If you're watching the replay, same deal, just pop it there and I'll be more than happy to answer those for you. Make sure that you hit the likes and loves so that I know that you're actually enjoying the content and that you're here with me and that I'm not just speaking to a screen. Okay, so let's just get started into it. So what is Hashimoto's? I'll just refer to it in the brief sense because it's just a little bit easier. So Hashimoto's is an autoimmune condition, okay? And the cells, your immune cells, have turned on you and they are essentially attacking the thyroid gland. And that's pretty harsh, isn't it? So the thyroid is a cute little gland, and it actually looks similar to this. So it's butterfly shaped and it's actually located at the base of the neck, sort of underneath your Adam's apple there. So your immune system creates antibodies that attack the thyroid gland, as I just discussed. So it's not actually recognizing that this is an imposter, such as a virus or a bacteria or something that's usually foreign to the immune system. And your immune system basically thinks that your thyroid gland is not a normal part of your body. So the antibodies actually damage the thyroid cells. They cause a lot of destruction, which actually destroys them. And this results in inflammation of the thyroid gland, and consequently it results in a decreased production of your thyroid hormones, so T4 and T3. And basically, you know, this can commonly result in hypothyroidism, which is an underactive thyroid, so it's not working as quickly as it should be. And in rare cases, your thyroid can actually produce too much thyroid hormones, but generally it's the other way around. So these antibodies can actually also bind to the thyroid, preventing adequate production of those thyroid hormones, as I spoke about, so T4 and T3. And furthermore, the antibodies don't always just stop at the thyroid gland, so they can cause destruction further beyond that. They can also bind to the acid-producing cells or the parietal cells located in the stomach, as well as they could bind to the pancreas and the adrenal glands as well. So rather destructive, aren't they? So what are the typical symptoms of Hashimoto's disease? Well, you may have some or all of these. You might not necessarily have all of them. You might have a few select ones. So they can be hair loss, thinning hair, brittle nails, puffiness in the face, fatigue, dry skin, constipation, feeling sensitive to the cold, joint stiffness and pain, depression or low mood, muscle weakness, muscle stiffness, tenderness or muscular aches, poor memory or concentration, swelling of the thyroid, so you might actually have a goiter there, weight gain, low libido, irregular periods or heavy periods. So this condition does actually affect the menstrual cycle and your periods as well. So that's important to keep in mind. And I thought it was an important one to discuss, considering that my specialization is periods, hormones, and menstrual cycles. But the thyroid really needs to be grouped into that as well, because it has such an impact on the menstrual cycle, whether you ovulate or not, what your period flow is like, what the bleed is like. So it's very important to discuss. So what tests should be done for Hashimoto's? So when looking at Hashimoto's test-wise, it's important to have an overall complete look of what's happening with the thyroid. So testing should include TSH, free T4, free T3, reverse T3, and the thyroid antibodies. So thyroid globulin antibodies and also thyroid peroxidase antibodies as well. Okay, so all of those. It's also important as well to rule out celiac disease, because it's an autoimmune condition and that can actually sort of fuel the fire, so to speak. So eliminating that through a blood test would be really, really important. Now, along with this blood test, it can be very valuable to actually do your basal body temperature. So getting a basal body thermometer or an ovulation thermometer and taking a temperature each morning. Now, if your temperature is below 36.4 degrees, that is usually associated with hypothyroidism, so an underfunctioning thyroid. So it's just a nice little tip or trick to be doing as well. I wouldn't rely on that solely to diagnose hypothyroidism or Hashimoto's, but it's just a nice little one to be including as well. Now, what actually causes Hashimoto's? So let's discuss it. So there's several underlying causes, contributing factors, risk factors, or triggers that can actually, make Hashimoto's worse and contribute to the disease itself. So things like stress, acute low-grade infections, genetics. So if someone in your family already has a thyroid disease or issue or an autoimmune disease, there's, it's most likely that you'll have that potentially as well. Now, having other autoimmune diseases as well, so things like type 1 diabetes, lupus, rheumatoid arthritis as well, that can increase your risk of having Hashimoto's. Environmental exposures, so exposures to things like herbicides, pesticides, fungicides, pollutants in the environment, household cleaning products that are quite toxic in the home. Food and drink exposures as well, so certain food additives, alcohol, things like that can also predispose you as well. This is a massive one, so gut issues. We really need to look at this. We simply can't ignore it in terms of Hashimoto's. So gut issues, I'm speaking about things like leaky gut. So leaky gut is an inflammation of the small intestine lining, okay? And basically there'll be particles that will be passing through from the small intestine into the bloodstream that shouldn't normally be there because the gaps are so big or leaky in that small intestine lining, and that causes your immune system to be on high alert, okay, because things are passing through that shouldn't be, and that will actually be a contributing factor to autoimmune disease, and it will lead to sort of high levels of thyroid antibodies which are attacking your thyroid gland, okay? Bacterial imbalance, this is really crucial as well. So this could be a bacterial imbalance either in the small intestine, the large intestine, or both. Okay, so a study has actually shown that if you have hypothyroidism Okay, there can be a 50% risk of having SIBO, so that's small intestinal bowel overgrowth. I know that I've spoken about that before, so there is that risk there. So it's very important to rule that out. That's an imbalance in the small intestine. In terms of gut issues as well, there can be allergies or food sensitivities as well that can be a contributing factor to Hashimoto's. Digestive issues as well that can also be a contributing factor. So poor elimination, so perhaps your liver's sluggish, maybe your gallbladder's a bit sluggish, perhaps you don't do a poo every day, perhaps you're a bit constipated. They can all actually contribute to Hashimoto's as well, and not having enough digestive secretions in the stomach to break down your food efficiently. So treatment of Hashimoto's, well, that really depends. There's so many different areas to focus on in terms of Hashimoto's, and it's not just simply about supporting the thyroid alone. Remember, as I spoke about earlier, those immune cells can potentially be attached to your pancreas, your adrenals, the parietal cells in the stomach as well. Remember all the contributing factors too, so environmental factors, what's going on there for you? Has there been any exposures? What is your gut function like? That's absolutely crucial to be looking at those things that are triggering the Hashimoto's itself. But 3 tips I would recommend for you. Let's go through those. Obviously, it's very, very involved, and there's more involved than just this, but this is a very good start for you. So I would suggest avoiding gluten. Gluten has to go. That gets the boot, okay? For the majority of people anyway, gluten is very inflammatory, and when you've got Hashimoto's, you just have to do away with that. There's already too much inflammation at the thyroid gland that's causing issues and causing those immune cells to attack the thyroid cells more and more and destroy them and stop the production of your hormones. So we don't want to add any fuel to the fire, okay? And it's very inflammatory to the small intestine. And remember, I spoke about leaky gut when there's lots of inflammation at the small intestine there. So not good at all. And considering that this inflammation of the small intestine and leaky gut is a trigger for that Hashimoto's, it's a no-brainer to avoid gluten, right? It's pretty easy in this day and age to actually go gluten-free. There's so much, different things that you can have, and it opens up your world really to a variety of different things to have instead. And furthermore, that inflammation as well from eating gluten can actually cause a rise in the thyroid antibodies, which are usually quite elevated already in Hashimoto's. We don't want those to rise anymore, because if they do, they're actually going to be attacking and destroying those thyroid cells even more. So we want to actually manage those levels as well as we can. So gluten is found in grains such as wheat and spelt and rye and barley and things like that. So just making sure that you switch over to gluten-free grains instead. That would be really, really important. Now, addressing stress. I can't stress this enough, no pun intended. But feeling relaxed and calm is absolutely crucial in terms of Hashimoto's, because if you're stressed, it does impact your thyroid function, okay? When you're stressed, it will actually put the brakes on your thyroid, and it will go and stop the production of thyroid hormones. So it will stop the production of T3, remembering that T4 converts into T3, but instead of producing T3, it will produce reverse T3 instead. So that's usually a sign that, stress is actually driving that production of RT3 or reverse T3 if that's elevated. So very, very important. It's going to, if you're producing too much reverse T3 and not enough T3, you're going to be in that state of hypothyroidism, so under-functioning thyroid. So really, really important to address that. So making sure that you take time out for yourself. involving self-care techniques. So whether it be running a warm bath with essential oils and Epsom salts, whether it be taking a stroll out in nature, perhaps that means, doing yoga and Pilates for you, or maybe it's just simply, making sure that you're taking a few deep breaths, taking 6 deep breaths just for a few minutes to sort of calm yourself. That would be very, very crucial. Now, the third thing that I would recommend is getting your gut bacteria levels actually assessed. This is really, really essential, as I've been highlighting through this live today, because 70% of your immune system is located in the gut. So why wouldn't you look at that? And considering that Hashimoto's thyroiditis is an autoimmune condition, you can't treat any autoimmune condition without looking at the gut and seeing if there's any bacterial dysbiosis. So what does gut or bacterial dysbiosis mean? It means that there's an imbalance between the good and bad bacteria in your gut. So you can actually get a test done known as a microbiome test. So that's looking at the good and bad bacteria levels in your large intestine. And these not so desirable bacteria can actually produce a lot of toxins in the body. It's very challenging for your immune system, and it will actually, cause further damage to your thyroid and contribute to Hashimoto's as well. So not all microbiome tests are created equal though, so remember that. So there's a lot of companies that are doing different, gut testing, which essentially assesses your poo. So it's looking at what bacteria levels are there, but they're not all accurate. So it's really, really important to get it done through specific companies that will sort of highlight a lot more accuracy in terms of what diversity you've got there. Is there bad bacteria there that's contributing to inflammation or immune system dysfunction and things like that? It will assess that in great detail, and that's something that I use in the clinic all the time, and I find it very, very useful based on that information to develop a treatment strategy based on that. So in terms of treatment as well, generally you'll be under the care of an endocrinologist who specializes in hormones essentially. So they'll be supporting your Hashimoto's thyroiditis. But in addition to that, I would always recommend having a naturopath as part of your care team as well. So especially one that specializes in hormones, such as myself, to help support you, with natural medicines, so nutritional medicines and herbal medicines, assessing if there's any nutrient deficiencies. There's a lot of things that the thyroid needs to be working in optimal function. So we need adequate vitamin D, we need adequate zinc, selenium. We also need adequate iodine as well, so making sure they're all good. And making sure that your pathology test results are optimal. You may have already been to the GP or the endocrinologist, and perhaps they've looked at other parameters and told you that things are normal looking. And that's because the pathology range is so broad, and the way that a doctor is trained is from an emergency room perspective. So if your results fall out of that really broad range, that's when they'll actually act, because they treat symptoms and disease. But you may be feeling crap in between that, and that's where a naturopath comes into it. We look at optimal levels, so between that really broad range, we're looking at sort of a more refined range within that broader range, if that makes sense. Also, you would be referred for microbiome testing as well. So looking at the large bowel, seeing what, bacteria is there, as I discussed, is there bad bacteria, is there good bacteria, etc., that are contributing to Hashimoto's as well. And also addressing, the underlying root causes of that Hashimoto's. It's not enough just to treat that thyroid gland. You've got to look at what's contributing. Has there been environmental factors? Is there, gut bacterial imbalances? Is there problems with digestion? Is there, things in the home that you're using, like toxins, that are contributing to it as well? So everything needs to be looked at, stress levels, etc., etc. So basically, I use a combination of herbal medicine, nutritional medicine, diet and lifestyle, naturopathic emotional release, which basically assesses if there's any underlying causes that are contributing to your Hashimoto's as well. And basically treating each individual based on what the pathology results are saying as well, and what your specific symptoms are as an individual. So if you are experiencing Hashimoto's, I would absolutely love to help you, and I would invite you to book a free discovery call. So basically the link is in the bio if you're watching on Instagram. If you're watching on Facebook or my YouTube channel, I'll pop the link down below for you, okay? So we can just have a chat and sort of work out basically if we're a good fit, and basically what would be involved treatment-wise as well. Does anyone have any questions so far? I'll just check Facebook as well, just to make sure. If you're too shy as well, you can always ask it later on and just pop it, in the comments box down below if you're watching later, or send me a PM or DM, and I'd be more than happy to answer that for you. And remember that all my Instagram and Facebook lives are on my website, so they're all there with the video and the written description underneath. So if you go to reproductivewellness.com.au/blog, they'll all be there. I should actually put a link in Instagram as well for you, so I'll go ahead and do that too. And I would like to thank you so much for watching. I really, really appreciate you. Taking the time out of your evening to come on and watch. And just be sure, if you're watching on my YouTube channel, that you like and subscribe so that you don't miss any future videos. And FYI, I will be here every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about something period, hormone, or menstrual cycle related. So thank you so much for joining again, and see you next week. Thank you. Bye.